Hi, everyone. If you are like most of the people that I talk to at some point, you've probably experienced that feeling of, ugh, my pants are too tight. I feel really bloated. There's something I'm eating that's not agreeing with me. Maybe you have irritable bowel syndrome. Maybe you've been told that you have a food sensitivity. Maybe there are foods that you're just afraid of eating because you have no idea how they're going to react. If this is you, you will definitely want to tune into this episode with Dr. Kim Bretz. Kim is a naturopathic doctor in Ontario, and her whole area of interest and expertise is gut health. And what shares with us in this episode will blow your mind. I'm making that really bold statement because there were a couple of things that I learned that I had never heard about before. So give it a listen. And as always, let me know what you think. Welcome, Kim, to the Midlife Feast.
Oh, thanks so much. I'm really excited. I love talking about this area of health and gut and women and all things. So, yeah.
And gut health, bloating, all the things that we're going to talk about today has been a frequently requested topic. And I'm so glad that you've agreed to come and talk to us today because I feel like you are going to be the perfect person. So let's dive into it. We're going to talk about some myths, but I do want to just kind of talk a little bit about what do we know about what happens to gut health, that big umbrella term, as we work our way through the menopause transition. So from perimenopause and menopause to postmenopause, what do we know? What is actually happening?
So, unfortunately, we don't know a lot. And I don't think that's terribly surprising because things are pretty horrific in women's health in general in the area of research. And not surprisingly, that link between hormones and gut is even less with what we understand. Now, what we do absolutely see is that women, and especially in what we call disorders of gut brain interaction or functional GI disorders like irritable bowel syndrome or constipation or dyspepsia, or things where we're experiencing symptoms that are not Crohn's or colitis or celiac, or sort of the ones that you get diagnosed on a colonoscopy, we see that these levels are really high, to the point, and specifically I'm going to use the numbers in Canada, but we see for women in their, especially in their reproductive years and leading up and into menopause, the rates of women having at least one of these disorders of gut-brain interaction in Canada was 47.6%. So basically 1 in 2 women are going to be experiencing this. And that study was done across the world. And we saw in general, same with Canada, rates in general for the populations were over 40%, and then close to that 1 in 2 for women. So it's very, very prevalent, even though we don't understand very much and why it's more in women.
Yeah, and I mean, certainly, I think that reflects anybody who works with women. Gut complaints, and whether that's constipation, diarrhea, irritable bowel, bloating, which we'll talk about shortly. Just that,
Yeah,
that discomfort has always been top 3 reasons why people come into
absolutely.
my office, virtually or otherwise. So
Yeah.
yeah, so I think that that's probably going to be pretty relatable for people. Do we know? And we don't know why, other than just
We
that it
don't know
happens.
why. Yeah, we know that we have things. So we have our hormonal fluctuations, and that's happening for every woman. I mean, our estrogen, progesterone go up and down within our cycling reproductive years. That's happening, and that's happening for everyone. So we can see in general, a lot of women will have a slowdown that's happening a bit before your period starts. We can get then water retention and bloating that's happening with that. And that happens for women who don't have a lot of complaints and women who do. And then we
Mhm.
also see around the time of the period when we have certain other chemicals that are released, we can often see that as our period happens, we're also getting loose stool that happens as I don't know, some sort of horrific design flaw that came in, but certainly not enjoyable. But then we have the menopausal transition, and our hormones are now they're very, very scattered in what's happening. So this feels like it's happening more often. We get more sensations that are happening around that time as well, but we also see sleep disturbances are happening and potentially more abdominal or pelvic surgeries have happened at this point. So again, changes happening in that area than we would necessarily see in a 20-year-old. It's often the numbers aren't as high. Psychosocial stress, traumas, certainly I know being in this
Mm.
midlife time, there's a lot of stresses and pressures that are going on, food changes that we've made affecting our
Totally.
microbiome. Like it's just this whole host of things that I think we want to say hormones, but it's so much more.
It is. I don't know who you had for physiology. I think we went to the same school in Toronto.
Yes.
But if I have one take home from those 4 years, this one physiology professor described our digestive tract as one big long tube with two openings.
Yes.
And I've used that analogy. I'm sure lots of people that I work with are nodding their heads, and I say that for most of our life, if things are working well, that tube is kind of like a sausage factory, and you have different
Mhm.
people at different stops along the line, and they know their job, and it happens, like a well-oiled machine with very little intervention. And then all of a sudden we hit our perimenopausal years and we're in this hormonal roller coaster. And all of a sudden, it's like everybody forgets where they're supposed to go. And so this sausage maker now is like a drunk sausage maker. And you're going to have periods of time where you're having lots of sausages coming out and periods of time when you're having no sausages being made. And it doesn't necessarily mean that I mean, obviously it's uncomfortable when you're experiencing that kind of digestive dysfunction and it's being augmented in this time of life. But it's hard because we don't have a fix for it, right? Like I can't
Mhm.
tell someone this is how we fix it any more than we can fix any other perimenopausal symptom.
Well, and I think that's one of the big messages that we have is that as our hormones are fluctuating, that portion of things, that is simply the transition that's happening. It's not that we can't fix the hormones. So it's not really that portion of it that we're thinking about very much. And the very few studies on hormones, what we've seen with a couple very not well designed studies necessarily, but looking at either birth control pill, where we've seen often a decrease in symptoms that are happening, and then conflicting results in menopausal hormone treatment studies. There's no consistency in what we're seeing. And I think that's because it's probably, we don't understand this yet. And we have
Mhm.
such a varied level of what's happening when the hormones aren't being given. It's that part of it isn't the thing that we're usually trying to fix because perimenopause and menopause, while there can be symptoms that we want to deal with, is not a disease. And that process is something that we need to have happen. We're not going to keep menstruating for the rest of our lives. So this is just a thing that is
Yeah.
occurring.
Yeah. Okay, totally agree with all that. Let's dive into the myths. So, one of
Mhm.
the most common questions that I get anywhere, whether it's in my practice, online, anywhere, is why am I so bloated? So, let's just let's just start with that. How
Yeah.
do you respond to that question? Because I'm sure you get that a lot.
Absolutely. And bloating, we actually see, especially in these types of things, bloating, there's such a quality of life thing that happens. It
Mhm.
has such a huge impact on how we mentally and physically feel. It is absolutely one of the biggest questions that I get. And we know when we combine bloating and distension along with our other conditions like IBS or constipation or dyspepsia, that we have worse outcomes and worse quality of life. So it's really important, even though it's not being talked about very often. So the
Can I
way that
stop you there for one
oh,
sec to
for
clarify?
sure.
Can we
Yeah,
talk about bloating versus distension? Because I think that that's an important one.
it is. So bloating is actually a physical, or sorry, bloating is a sensation. We feel that pressure or gas or something, and that's the way that we're describing it versus distension, which is actually where we see our abdomen press outwards. So there's that physical, I'll often get that comment of, I look 4 months pregnant, I look
Mhm.
6 months pregnant, I look 8 months pregnant, where we see it happening. So
Right.
that's the big difference that we're talking about there.
And
Um,
I think that's so important because I think a lot of people don't realize that there really is a difference, and maybe as we'll get into, there's a difference in what's happening usually. Like that,
Kind of, yeah,
distension can have a lot of physical causes that
correct.
need to be looked into and things like that versus bloating, which may have more, certainly can have physical causes as well, but sometimes not things that we can fix, right?
Well, and it's kind of interesting because we're seeing different things right now, which is really exciting. But
Cool.
the way that um, hopefully we're seeing people think about it right now is that we're trying to figure out where people are on a sort of a continuum of, is it altered physiology? And again, sort of a Crohn's or colitis. Those are sorts of
Mhm.
physiology, strictly physiology conditions. And then is it an altered perception condition? And bloating is usually going to fall more on the perception side of things. And we've seen that recently with some studies that came out, I would probably say within the last 10 years or so, that are looking at individuals who have chronic bloating and distension and comparing them to individuals who don't. And they're doing MRIs to look and see how much gas are you producing when you feel the bloating or see the distension or have a challenge meal of something that would tend to make most of us feel pretty gassy, and see what is the magnitude of gas that you're producing. And in that study, we saw that 25% of people who experience bloating and distension are actually producing more gas or have it in sort of abnormal pockets that we were seeing. That means that the other 75% are producing normal amounts of gas. And when we're thinking about this category, this umbrella category of disorders of gut brain interaction, we're seeing that there's a miscommunication between the gut and the brain. And we start feeling our digestive processes happening. So for a lot of people, they're feeling the gas that they're producing in almost any level, versus those of us who don't experience bloating and distension, who are then just not feeling the experience, kind of like I wander around my day wearing glasses, but not noticing them most of the time. That is what is supposed to happen. But this
Oh,
heightened sensation, we start to feel things a lot more than we should.
that is fascinating.
It is absolutely fascinating. And I'm going to
I
say,
have
like,
like 8,000 questions and I'm going to try and like keep the lid on for a minute.
yeah, can I just say one other thing with this? Because this
Yeah.
gets even more fascinating. Because when I talk about this, all the time I see patients, or if I'm presenting at a conference, practitioners, I see their hands going up at this point, because it's like, but what about distension? Because I can see the extra
Mm.
gas. And that's where I think we take the one step that becomes even more interesting on this. Because if I think about when I get stressed, I get a lot of tension in my shoulders and neck. When we have a lot of GI stress that goes on, and we actually, for some people, will have a specific diagnosis around gastrointestinal symptom specific anxiety, but we'll see in a lot of individuals that there's a contraction that will happen in the diaphragm. So when we eat, this muscle that sits kind of on top of our abdominal organs, it's supposed to relax, and it actually goes up and it makes more space in our abdomen, so that when we bring in food and we bring in liquid and our bacteria produce gases and do the wild and wonderful things they do, we have extra space for that. But when we've had GI issues going on for a long time, we start to contract our diaphragm and it pushes down onto our abdominal organs. And there's not a lot of space there. And I would say, especially for women, and also think around this around the time of our menstrual period, when we're also drawing in more water, our endometrial lining has thickened, like there's not a lot of space in there, and we're contracting everything now. We can feel things more acutely in that scenario, but we also push out because there's nowhere else to go. Although flatulence can also become part of this as well. But this is part of it, is that sometimes 25% of people were producing more gas. We can see it extend, but 75 are not, but we can have this abdominophrenic dyssynergia, which is the diaphragm not doing what we want it to do. And we're seeing distension and thinking that must mean more gas, and it may not.
Okay, that just blew my mind because I have never heard that piece of this before.
It's so
Wow.
exciting where we're changing and where we're going and retraining and rewiring this miscommunication piece, which is, I think, the really exciting part around. We used to say, like, just get less stressed and just don't eat dairy and see what happens and good luck to you. And then that became, let's kill off the bacteria and let's take away all the food and I'll meditate. And now we're actually getting concrete strategies around how to deal with this, pairing together our understanding around where we kind of got it wrong, along with having more options available. I think this is a really
Mhm.
exciting time in this area of health because we've let people
Yeah.
suffer. And this is the thing, when I talk about this, sometimes again, there's this idea that it's just stress. And it's not just stress. It's legitimately that there is this miscommunication in the brain. We can see pain centers lighting up. So even though there's not more gas being produced, we are getting signals that something is really, really wrong. And of course, we feel like that is dangerous. Of
Mhm.
course, we do. You're not supposed to feel your digestive process is happening. It is weird and scary to have that happen. And then to be told that nothing's wrong, it's hard. It's really, really difficult for people. And we're moving past that point in time of there's nothing wrong. We can't fix you. We don't have options. And that's amazing.
It is amazing. And I don't know if you've seen any research about this, but I'm certainly know what I'm doing when we hang up. Is so many people who are experiencing body dissatisfaction, it
Mhm.
is centered around their abdomen.
Yes.
And many of us, kind of trained ourselves to like suck it all in and hold
Mhm.
everything tight, right? I
Yeah.
can only imagine how that is playing into all of this.
I think it is playing a part, even if we may or may not have strong research about that, but we are seeing things around biofeedback and pelvic physiotherapy and some of the physical things to help us in this area. But we still see a lot of times that people are thinking the solution has to be take food away. Because when we
Mhm.
take food away, two things are happening. One is that we're not producing as much gas. Certain foods feed our gut bacteria and they ferment those carbohydrates, and they turn it into gases and chemicals. And those gases, for people who are sensing things a lot more, feel uncomfortable. So it can feel better to take them away. Or when it goes further, and you'll hear this a lot of the time, that first, it will be like I'm bloated at the end of the day. And then it can feel like I'm bloated after any meal. And then it's just I'm bloated all the time because now we're just responding to any stretch receptor that's being
Mhm.
affected in the gut. So we start feeling all the things all the time. And that starts to feel like things are more and more dangerous and I must take away more and more foods, even if it's not consistent, or I get bloated with drinking water. I feel too full with water. And I often, again, sort of talk about this with practitioners, that what is the condition where water makes us feel bad? That should
Mm.
actually be a warning sign that if there's more and more things that make us feel full or bloated, or we have to eat smaller meals and we can't find anything on a test, we need to start thinking about perception issues versus continuing that micromanaging around damage or around diet, sorry, and thinking that we're going to find the one magic food. Versus what we're starting to see now is the more restriction that we have, the more we're seeing this sensitization and what we call visceral hypersensitivity, where you start feeling everything in a much more heightened way
Yeah.
around your organs. We see motility changes. So again, a sensation can cause a physical change. So we see a lot of the time constipation, which is going to increase that sensation of bloating and gas happening and distension. Um, But we can also see gastric accommodation. So our stomach doesn't expand properly. So we're getting all of these physical changes in response to the more we restrict, the more we, even things like intermittent fasting. A lot of my patients will intermittent fast, partly because they've heard about it because of weight loss, but partly because they'll feel better for the part of the day when they don't eat food. But then they eat a lot at the end of the day, and then all their symptoms are ridiculous through the evening. But they're like, I made it through work, I made it through my kids coming home from school, but it's not a solution. And so when we try to have things again, if we don't work on some of these other pieces, we just feel bad every time we bring something back, and we think again, something's wrong, I need to try harder. We become way more hypervigilant. It's very difficult for people.
It is. It is. And we're going to keep talking about this. But what I want to do is to just kind of sum up
Yeah,
that, bloating, it's not a myth. What you are feeling is real, but it may
100%.
not be the reason why you have been led to believe, or that there's more to it, and we're learning, and that there is likely this complex interplay of things, but it's not usually always something that needs to be fixed in the way that many have been led to believe.
Right. And I think some of the bigger things around that being fixed has been taking away food and constantly doing things to kill your microorganisms in the gut,
Yeah.
which changes your perception, but you can't just keep killing bacteria and not eating food. Like it's not a good strategy in general for health. It's a horrible strategy for quality of life. And one of the things that I'm really looking for within GI health is that people can enjoy food. Like, that is
Yes.
something that we're looking for, because I don't think health is not being able to eat with your friends and family and being afraid to travel and seeing that kind of your world get smaller and smaller while you try to micromanage and whack-a-mole your symptoms within your GI health.
Mhm.
That's not getting us to where we
No,
want to be. That's not health.
it's not. And I mean, anybody who listens to this podcast probably like 100% agrees. And I think that the selling of solutions to symptoms that
Mhm.
aren't problems that need to be fixed in that way
Yeah.
is a big problem across the entire spectrum of health, right?
Yes.
Taking a symptom, which can be a symptom of something very real, sometimes something very serious, but not in this case usually, and then trying to prescribe this like regimented, do this, do this, do this, do this, and this is
Mhm.
how you cure it,
Yes.
has led so many people down years, if not decades, of disordered eating. And I certainly
Very
see
much.
that, people will come to me and saying, I saw my first naturopath when I was 16, and when I was diagnosed with XYZ, and then my food sensitivities have just gotten worse. And now that I'm in perimenopause, I can't eat anything.
Mhm.
And
Yes.
it's really hard sometimes to say that, I totally understand that what you're feeling is very uncomfortable. And I believe you that your symptoms have gotten worse, but it's not because you're more sensitive to foods. It's not because there's more pathology happening.
Mhm.
You've trained your gut in a way to react this way, by
Yeah,
putting less diversity
inadvertently.
in,
Yes.
right?
Yeah, yeah, it's that very inadvertent trying to do the right
Yeah.
thing, and one of the things that I've been talking about with some of my colleagues is this idea, especially I will say in natural medicine, of being early adopters. And it's
Mm,
something that I think we identified that, and correctly, that food can aggravate symptoms for people in GI sort of stuff. And it was only in 2014 that one of the American gastroenterology associations was like, oh yeah, we're going to identify it now. When people had been saying, this is a problem, this is a problem, this is a problem. But I think one of the issues with being early adopters is if we don't keep up with the research, we keep kind of giving the wrong message. So now, yes, food is aggravating people in some cases, but not because the food is bad in most cases. There's things like nut allergies and celiac disease where, sure, I'm not going to be saying like, here, eat this peanut, I'll hold your EpiPen. That's
Yeah.
not what we're looking at. But in many of these other types of conditions, we're actually now seeing that some of the things that we thought were intolerances or like things like that, or allergies, and I'm using air quotes right now because like we were using the word wrong
Yeah.
and thinking that the solution was just to avoid those foods. That early adoption of that idea, we could empathize with our patients really well because we did believe that this was happening, but now not being able to move away from it and look at, okay, there may be other things that are part of this condition, and actually continuing to hammer down this pathway of take away more and more foods is actually spiraling a lot of people, especially, I'm
Hmm.
going to say, especially in GI disorders, and especially with our female patients in GI disorders, because there seems to be more sensitization that's happening in this population. And that's what I do. So I'm going to generalize to that, but I think it's a
Yeah.
problem in so many areas.
Absolutely. And I just want to add one more thing, and I feel like we have to move on because we have so much to talk about. But one of the things that I used to do, full disclosure, because that's how I was taught, is that if we put someone on an elimination diet, that when we reintroduce the foods, we would do like 3 servings a day for 3 days,
Yes.
right?
Yeah.
And that's like the recipe for disaster,
A
right? If your gut
100%.
bacteria have not had these foods, and then all
Yeah.
of a sudden we literally throw large quantities in, it's going to upset the apple cart any day of the week.
For
And
sure.
so,
Yeah.
when I tell people, oh, well, why don't we just try reintroducing some of these things so that you can have more options and we can have more diversity in what you're eating? And I say, I want you to have a tablespoon of hummus twice a week. And they're
Yes.
like, what? And I'm like,
Yes.
no, no. If you have not had beans and legumes for 20 years,
Yeah.
you're starting with a tablespoon twice a week. And it's incredible how just taking the slow, steady approach of like giving, your gut bacteria a slow introduction, it's like knocking
Mhm.
on the door instead of barging in the house,
Yes.
really makes all the difference in the world.
I agree. And we work, especially with our reintroduction programs, on when people have been kind of prescribed diets, and some of them, they're appropriate in the situation, like a low FODMAP diet and irritable bowel syndrome, but there's no plan to get people off of it, or it's just like a here, try foods, and then it goes badly for some of our patients. And if we see not just that we haven't been feeding the microbiota, but we're seeing a lot of this sensitization, hypervigilance, our selective attention on symptoms, we may be going even lower. And we're kind of talking about what is it like to sit with a symptom if it's not dangerous. Like,
Mm,
this is a really hard thing to go through, and that a lot of people are trying on their own and then feeling scared and like
yeah.
something is really wrong, and then we want more testing, and it kind of spirals in this um, very, very hard scenario
Yeah.
that is also often coinciding when our hormones are making us not sure what's happening as well, and you're just like, I can't do this. And yeah, it's
Yeah.
very challenging.
Okay. So let's talk a little bit about foods. And I know one of the questions that I get all the time is what foods cause bloating, Kim?
Yeah. So when we're looking at that, there are certain foods that contain components that all of us as humans cannot completely break down. And they're often found in our beans and legumes, our grains, some of our nuts, a lot of our fruits and vegetables. So plant-based foods are generally the ones. And it's actually interesting because when I was a naturopathic student and I learned the fact that 90 to 95% of our food is digested and absorbed in our small intestine, I was fascinated with the small intestine, and my care about the large colon was almost nothing because I was like, it's just a repository for waste. Like, water comes back in the
Yeah.
body. Congratulations, yay, large colon, we're done. But I also wanted to think about, how do I get that extra 5 to 10%? Because shouldn't I want all the nutrition for my own human cells? So 90 to 95%. We very deliberately, and I don't know how this was set up, but we don't break down all of our food, and especially within our carbohydrate foods, we don't have certain enzymes to break it down. That 5 to 10% ends up in our large colon and it feeds our bacteria. So they ferment it and they turn it into gases and chemicals. And that's a really good thing. We need that to happen. I'm going to say germ-free mice where they don't have any bacteria in them. They're weird. They're just weird. One of the things about North America is we're losing our diversity and richness in our microorganisms. And part of that is we don't feed them. Some of that is a North American diet where it's highly processed and we just lost those things within our food system. But some of it is where we're deliberately taking them away because the gases make us feel uncomfortable. But some of the bigger ones, I actually see people when they decide to go keto, which hurts my microbiome loving heart, are things like cauliflower and onions and garlic and stuff are really high. And then people go on these diets, which already I have concern about. But if you have a sensitization issue and you're like, I'm going to eat all the cauliflower rice in all of the lands, it's going to make you feel horrific. Like that, apples are really high, but these are all foods that we want to be moving people towards. And for many people, they're perfectly fine and they don't notice the gas production at all. Like it's producing gas for all of us,
Yeah.
but for the people who it's affecting, yeah, we need to work on how to make you not feel it because you're not supposed to feel it. Um,
Yeah. So you touched a little bit on FODMAP, and I feel like that's a good one to kind of just circle back to for a second, because
yes,
there is, and correct me if I'm wrong, but there is a large, good evidence base for using this as a therapeutic intervention for people who have IBS, right? Am I
correct.
wrong? Right?
No, that is correct.
Okay.
Um, and it always has the caveat of this is short term. And I actually often use it to help me understand, are we getting a lot of this sensation issue that's going on? And we can help with people like decreasing their symptoms while we're working on some of the other stuff. But for
Yeah.
me, our reintroduction starts within 4 to 6 weeks of starting the program. And it's a very like timed what we're doing, which we can
Yeah.
slow down and speed up as we need to. But so yes, the guidelines are clear. It's a reasonable option to use with the the very big caveat that we should be off of it within a few months. And many people that I'm seeing are coming in on it for years.
And that's a symptom of, because I see the same thing, that's a symptom of DIY culture,
Yes.
because you can download guides and apps and you can do this whole therapeutic intervention
Yeah.
without any consultation with a professional, without
Very much.
any discussion of pros, cons, risks, benefits, how to start, how to stop, how to modify it to fit your life. And so people will hear, see, be told that a FODMAP diet is good for a low FODMAP diet is good for IBS. And then they'll just be like, oh, there's an app for that.
Well,
And they,
but it's
right?
also challenging, and I'm going to say in a healthcare system where it's hard to get into a gastroenterologist, it's
Oh,
hard
yeah.
in primary care to get someone who really knows about this. They're often like, hey, go on a low FODMAP diet, and you're not going to come back at the beginning because your symptoms are lower. And it's often funny because I think I can convince people to try a lot of things because I'm going to talk through the why we're doing it and what is our roadmap and where we're going. But in some cases, it is harder to convince someone to come off of a low FODMAP diet than it is to go on this insane diet where we're saying you can't eat onions and garlic and cauliflower and apples and like
Yeah,
many wheat
absolutely.
product and all of these things. Like I think sometimes people are happier to do that to avoid them until it doesn't get better anymore. And that's what we often see is not only is it not good to stay on it and just beyond the social context of it, we're not feeding our gut bacteria, but usually at a certain point, because this isn't helping the underlying miswiring, like some of the bigger pieces
Mhm.
that are going on, then the symptoms start to come back, even though you're doing this. And that's where we see now people are like, should I take out eggs? Should I take out meat? Should I try like, and it becomes even worse in those scenarios.
Oh my goodness. Yes, I've seen that 1,000 times. I've
Yeah.
seen that version of, right?
Yes.
So if I'm understanding and hearing you correctly, there are many foods that produce gas in our colon, which is ultimately a good thing,
Yeah.
but not
We
everyone
all produce it.
experiences bloating or discomfort or distension. So that there isn't one food or group of foods or foods that you should always avoid if you experience bloating, or never
Yeah.
avoid. There's no list like that, right?
Absolutely. So yeah, I think that we can use some food stuff as a point in time to figure some things out and to help people feel a little bit better while we work on the other stuff. And that's where, going back to where we started on that figuring out, is it altered perception? Is it altered physiology? There may be other things that we need to look at to sort of figure out what's happening. And usually it becomes multifactorial because if we're not eating as much. Like I saw this question recently around, I had a patient with constipation and they wanted to do a reset and they fasted for 3 days and then
Oh,
their symptoms got worse. I'm like, of course it got worse because we require food to, like, it just, sometimes the things that we're doing are so not logical, but the bloating may feel better during that time period.
I
But it's just
know.
this weird sort of, there's so many pieces here that we need to think about, both from a physical and a perception sensation. But yes, there's not the there's not a food that I'd say this is causing bloating in people versus not happening in the vast majority of people who don't experience bloating and gas, like legitimately in the studies, and they range, but we're all supposed to produce, I think, 1.5 to 3 or 4 liters of gas every day. And
Yeah.
many people don't feel that at all,
Yeah.
eating exactly the same
So
foods.
important. So important. And I mean, for any practitioners who might be listening, and even patients, I think it is also really important that the integrative health world, while very well meaning, and that includes our profession of naturopathic
Mhm.
medicine, often creates a little bit of a haven for people who might have some disordered relationships with food and even eating disorders, to have those food rules validated.
Yes.
And I think that it's so important, for practitioners listening, and I do this a lot in mentoring conversations with others, that you really have to weigh the pros and cons of telling someone that they can't have something,
Mhm.
or that they shouldn't, especially if they already have a very long list of foods that they don't eat. That needs to be
100%.
a red flag. And I think all practitioners who work in this area need to at least be aware of how to screen or refer for eating disorders, because it is rampant,
Yeah,
and
absolutely.
increasing in women in midlife.
Well, and I think with that as well, there was a conversation that we had with some colleagues around the idea that naturopathic medicine is where eating disorders go to hide. And it's made more challenging that for a lot of people who go into healthcare, and we see studies around dietitians and MDs, and we don't have them for NDs at this point, and I don't know that we will, but the high number of disordered eating or eating disorders in healthcare providers, and the fact that we will often go into these types of conditions because we saw a benefit with it. But with our healthcare practitioners, and I think about naturopaths in general, we live in a world where having these restrictions has become normalized.
Yeah.
And we can find our way within this. Not that I think that's good necessarily, but we can go to a conference where our salad is broken down into everything in individual ingredients, and then you just make your own thing, and it's all inherently wheat and dairy free and soy free and like all of these things. But most people don't live in that world. And so when we're asking people to do things and have expectations around what is happening in the world where you have to go to your in-laws' house for Thanksgiving and have this list of things, or you can't eat in an airport. It just, we're underestimating the impact based on our own personal lifestyles in some cases. And
Totally.
I think as patients, we want to be really cautious about, if we're hearing some of these things, that like this is what I do, and these things, that can be a reverse red flag around how do we think about our practitioners and what are their goals for us. And it's a hard situation, but sometimes as much for patients, we need to be listening to what our practitioners are saying in the same way that I need to hear some of the warning signs about what my patients are saying and what I think about restrictions or how do we approach food and where is it a complete contraindication and where do we need a team that's going to be working on this.
Yeah. Oh my goodness. I feel like we could talk for like 8 days,
Of course
but
we
in
can,
in
yeah.
in the interest of letting you get on with your day, is there anything else that you think, that you want to share or that you think would be helpful to anyone who's like, "Oh, this is me."
Yeah, so I think one of the things that I love about this area is that it is growing a body of literature and people who are working in this area so much more right now. And so I feel like sometimes it can just get into there's nothing that can be done. This is an area that I think we're going to see quantum leaps. And with the change in how we're understanding it over, I would say, the last 5 to 10 years, with having this different approach to things, I am seeing so many more people who are coming off of their like even holidays through December saying, you know what? I ate with my family or I didn't think about my symptoms. And that's not a restriction thing anymore. Like it's changing the way that I practice, it's changing the way that patients are experiencing their relationship with their health and food and their families and community. I just think it's a really exciting time right now to be working in this area, and that patients, I think, can have a lot more hope.
That's amazing. I love it. Food freedom, definitely.
Yeah, yeah.
Okay, so how can people learn more about what you do and where to work with you?
Yeah, so we've got a website at drkimbrettsnd.com, and Instagram is probably the easiest place for people to find me. Those are the big ones that we see.
And we'll have those in the show notes as well.
Absolutely.
So what do you think is the missing ingredient in midlife, Kim?
So I've been thinking about this a lot as I've just come off a few years of midlife just chaos and burnout and being in a place that I didn't want to be anymore. And I think it really is that community of people that can support you.
Mm.
My planning for what my second half looks like is not so much about places and things. It is about who is going to be with me along the ride. That is my thing.
I love that. I love that. That's amazing. Thank you so much for sharing your time and expertise today. This has been wonderful. Thank
You're
you.
welcome. Thanks so much for having me.